Hi everybody. Super happy to have you all here tonight. Tonight for our Piezo Wave Users Forum, we have Dr. Katie Ellis with us. Dr. Katie Ellis is joining us from California, and she does work at Animal Wellness Center of OC with the small animals out in California, but also plays with the horses when time allows, which we hope is a lot because that's the fun part of the day as a
Great.
horse person. But today in recognition of the fact that this month is the holistic conference in Reno, we're focusing on the holistic aspect of the piezo wave for veterinary use. And as always, guys, raise your hand, pop in, put up questions in the chat, however you want to. Feel free to ask questions. We want to learn from each other, and we appreciate Dr. Ellis coming to give us some information and some cases, I believe, and then hopefully we can have some sort of a communicative conversation so we can all learn from each other. So with that, I'll turn it over to Dr. Ellis.
Thanks, Cindy. So, hi all, Katie coming from California. Thanks for watching. I'm going to keep it kind of brief because we want to keep this interesting and, like Cindy said, keep things chatting. So first, just going to kind of go over the few things that I find really important about using shockwave therapy and why I choose it and some of the cases I like to choose it on, and then just going through kind of a variety of a few different cases and how they've kind of lent themselves to using the shockwave. So we'll just jump right in. So one of the biggest things that I'm using Shockwave for every day in practice is pain management. So I'm using it on a ton of my osteoarthritis dogs, dogs with soft tissue injuries. We see a fair amount of sporting dogs here, so I'm using it a lot in them. But just in generalities, the whole reason that shockwave therapy works to manage pain is that that concentrated release of energy does trigger a series of biomechanical reactions. So it reduces substance P, it releases nitric oxide, does a lot of other fun cellular level things that reduce pain. I've found in practice that there's really very minimal downtime or soreness following treatment. I very rarely have an owner come back to me and say that their dog felt worse. And if they did, we just work on a lower intensity. But in my cases, I typically start them on lower intensities and increase over time to make sure that they're comfortable and rarely have a problem with soreness. I've also found that the analgesic effects of using this machine are super fast, and I don't have exact literature about that, but I've had owners come back to me saying that by the next day their dog is feeling better. And I always kind of reference my horsey side of life in this, in that in any sort of sanctioned horse competitions and in racing, a horse cannot receive shockwave within 3 days of an event. So like that's how quickly and how efficiently it's working to block pain, because we don't want these guys to go out and hurt themselves running through pain or not having pain, I should say. Long-lasting effects is another one of my favorite things about shockwave therapy. Especially, I find a lot of people are more familiar with laser therapy, and a lot of general practices do have laser therapy, but it just doesn't last. So I find with those dogs, they're coming in for treatment once a week, every other week to maintain comfort. Whereas with shockwave, I'm treating dogs, my initial protocol, which might vary from others, is that I typically treat them twice a week for 2 weeks and then intermittently and on an as needed basis from there. So I've treated partial cruciate tears where we do those initial 4 series and I don't ever see them again. So whether they became complete and had surgery later, I don't know. But I've also had dogs that will come back every 3 to 6 months because, oh, hey, they're looking a little sore again. So I've found that the effects and the long lasting is super helpful, particularly when people can't get into the office as frequently, dogs that are super nervous coming into the office. It's just really helpful to have a modality that we can use that doesn't require as frequent of treatment. The other big thing that I'm using Shockwave for is actually its healing properties, as my old lady dog gets up over here. So kind of like we talked about with improving pain, there's a lot of cellular things that happen, and we don't really need to get into that. But we also are releasing growth factors and promoting angiogenesis so that blood flow is helping with healing. And then in soft tissue injuries, it actually works to realign fibers and stimulates collagen production. So that's really helpful. I'm treating a lot of shoulder tendinopathies with this. I'm treating a lot of patellar ligament desmitis with this. So it's been really helpful in the soft tissue injuries as well. And then bone healing, there's even several studies out there that talk about how it can promote bone healing. So the most common thing I'm using it for from a bone standpoint is post-op TPLOs. And in the study back from 2015, they did report that dogs who were receiving the Shockwave treatment were more weight bearing following their 8-week recheck. So doing great things. And I try to tell all my surgeons that are referring to send them over. And I'll give you some more information on a more specific case that actually did really great using this for his bone healing. As far as case selection goes, kind of like I've already alluded to a little bit, but again, one of my other favorite things about Shockwave is that I frequently pair it with some of my other alternative modalities. So if I looked at an average schedule in my day, I'm seeing at least 3 to 4 patients where I'm doing acupuncture and Shockwave. That's really one of my biggest kind of appointments that I do. I do a lot of acupuncture, I do a lot of Shockwave. I used to do a lot of laser. I almost never use laser therapy anymore, very rarely. So almost all the time I'm reaching for this, particularly in my old geriatric osteoarthritis dogs. One of the biggest things about the piezo wave in particular is that it does not require sedation and the sound level is very low. My seniors, my geriatrics, not requiring sedation. I know that's a hesitation, especially with people who aren't as familiar with the newer systems, but I have not had to sedate any patient for this. I have not had any patient who could not tolerate this treatment. So it's really easy to use and it's fast. It's faster than laser treatments. So sitting and waiting for laser, I think frequently takes a long time. My shockwave treatments are going a whole lot faster. I use it a lot in dogs who have comorbidities that do not allow them to have medications. So I'll talk more about that in some of the cases too, but dogs with kidney disease who can't have NSAIDs or GI disease and can't have NSAIDs. I see in our practice a lot of dogs who are coming for alternatives to just medicinal pain management. People are looking for other options other than giving Rimadyl for the rest of the dog's life. So this is one of the things that I reach for the absolute most. And kind of like the medications, some dogs can't have the alternative therapies like laser therapy. We all know that we can't use that in cancer patients. And with laser, it goes into tissues and that light gets dispersed. Whereas with the shockwave therapy, because it's so targeted, we know that we're treating exactly where we want to be. And it's a very focused treatment, which I also find to make it more effective. And again, just I do it, oh, I guess I wrote that twice, my mistake. It pairs really well with other things. So I'll even do shockwave therapy in addition to rehab. We do a lot of physical rehabilitation here. So we will sometimes treat dogs with shockwave before they're doing their exercises or before they're going into the otter water treadmill. And I actually find that they seem to be more comfortable if they've had their treatment first. So I use it all day, every day with all of my other kind of alternative modalities. So we'll just kind of jump into some cases for some more fun and interesting talk. One of my first is Sweet Halo, and hopefully you guys can see her. She is a 16-year-old spayed female border collie mix who came into me for really kind of end of life mobility care. So she was kind of stumbling through the door, very short strided, having a lot of trouble moving around, and really couldn't take NSAIDs or gabapentin. She was very ataxic on gabapentin and had like a protein losing enteropathy, so we didn't want to play with NSAIDs. So we were looking for other options. She had been receiving laser therapy at her primary care, and it just wasn't helping her. So I'm not sure how clear these come up on everybody's screen, but she had some pretty gnarly elbow arthritis bilaterally, also had severe hip DJD. So we reached for the Shockwave. She was also getting acupuncture. But we did kind of my initial protocol of the twice weekly for 2 weeks, and the owner was super happy with results. She was taking the dog on longer walks. The dog was able to walk with the younger dogs in the home again and wasn't having to lie down or go in her wagon. Her mom always brought a wagon with her. So she was finding that those walks were getting longer, more comfortable, and just really responded very, very positively to Shockwave. So we started treating her after that initial series every other week. And unfortunately, she passed last week, but we did help her a whole lot with that Shockwave and had great response. Another little bit different case, kind of the other extreme, young wild Labrador. So this is Theo, and he was a 2-year-old neutered male lab who came in. This poor dog had had 3 MRIs and a CT scan trying to figure out a thoracic limb lameness that really was kind of undetermined for about 8 months. It was an extreme case. And ultimately, they had done some repeat MRIs and decided that it was a supraspinatus tendinopathy. So originally, he went to another treatment facility who had a different brand of Shockwave. And the dog was terrified. So they actually had to stop treating him because the sound was just too loud for him to handle. Very, very scared. So when he came to me and I said, oh, it's a tendinopathy, I want to do Shockwave. Of course, that's my first choice. Owners were super hesitant and worried. So we got the machine out, started it on the lowest setting possible, which is another thing I love about the Piezo Wave is how low I can bring that intensity. We started small, worked our way up. By the last treatment, we could do it no problem. The dog was extremely tolerant of treatment. Owners were thrilled. Dog went back to being a normal 2-year-old Labrador, and I have not seen him since. So he's doing really great. And just, I love seeing all the different variety of cases. So I know I talk a lot about seniors and geriatrics because that's a huge part of my caseload. But now we see these younger guys, especially super active dogs with things like tendinopathies, and Shockwave is always my #1 choice to treat them. Next, another senior Labrador guy. So this is Hennessy, super sweet pup. And he came in for kind of hind end weakness, inability to get on furniture anymore, and just a decline in mobility and what his owners felt like decline in mental health. He was depressed, withdrawing, having a hard time getting up and down. He had been seen by his primary, had been prescribed your typical NSAIDs and some gabapentin, didn't see a big improvement with that. So they came to me looking for alternative modalities. I again reached for my Shockwave because that's what I do. And we started treating his lumbosacral junction and both of his hips. And this was one of my favorite cases because the owners called the next day to say that the dog was so happy when he got home, went all to the owners, jumped on the couch, and just was playing with all his toys, feeling like $1,000,000. So it was incredible to see how quickly that this modality can really make dogs feel better, which also comes with the caveat that I always tell people not to let them go wild because we don't want to enter something else when they feel so good. So just a fun one where, again, we're managing osteoarthritis pain and reducing a need for medications. Kind of like I alluded to earlier in our bone healing kind of variety. So this is Dino, this big wide pitty guy, and he came for rehab after having bilateral TPLOs. And he came to me initially, the owners weren't sure if they should set up an appointment because the dog was not doing well. He had gone in for 6-week post-op radiographs and still had Lucency's osteotomy sites. And the surgeon prescribed an additional 6 weeks of crate rest. So we were kind of just going back and forth. Don't want to step on anybody's toes. How are we going to treat this dog? The owners wanted to come in, but I like to respect surgeons and their requirements for exercise restrictions. So I said, hey, can we do some shockwave therapy to see if that improves our bone healing? Like, that's the one thing I can offer. Different modality. We're not going to be exercising the dog at this point, but let's try this out and see how he does. So, did my normal protocol. The owners were thrilled that the dog almost immediately started to show more normal behavior. So he was starting to lift a leg to urinate, standing on one leg at a time. He was starting to lay down more comfortably. So they said he always used to kind of do the seal lay or the frog dog, and he hadn't done that since before his initial cruciate tears. He was back to doing that again. They were having a harder time keeping him exercise restricted because he felt so good. But through that series of treatments, they went back another 6 weeks later for repeat radiographs and to get some clearance for exercise from the surgeon. And his osteotomies had completely healed at that point. So this was the only thing that changed in his treatment. Of course, time heals a lot, but the ability to speed up and improve that healing because he was not recovering well from his surgery was just something really great that we could offer for him. And then my last case here, special to my heart, this is my dog Kaya. She's a 15-year-old spayed female golden retriever mix. And she's the reason that I got so passionate about Shockwave. So she, a couple years ago, had an MRI, had severe lumbosacral stenosis, and she's a dog who cannot have NSAIDs because of her chronic kidney disease. She does not tolerate gabapentin. She's extremely ataxic. So we were having just a really hard time finding a therapy that worked for her, and especially something that was non-medicinal. So had done laser before, didn't really see big changes. I was doing acupuncture. She responded well, but those effects didn't last a long time. So that's about the time we called Jody out and sampled the Piezo Wave. And from an owner standpoint, it was incredible. She started getting on the couch again. She started going upstairs again. And I was completely sold on Shockwave after that time. So I treat almost all of the lumbosacral dogs that I see with it, and I have yet to have a patient that does not respond positively. And it's really kind of like we talked about earlier, the ease of spreading treatment intervals is really helpful. So for her, like, she's getting older now, she's almost 16, so we're doing it more frequently. But initially, when I started this about 2 years ago, I was treating her every 4 to 6 weeks as kind of a maintenance, and she responded extremely well to that. So even from a financial standpoint, as an owner, to be able to have a treatment that makes your dog feel so good and to be able to space it like that and not have her on medications every day, that to me was just absolutely huge. So I feel like I've gotten exposure to shockwave therapy as both a vet and a dog mom. And I couldn't reach for it more in my day. I think anyone who works with me would tell you that this is my number one modality to use. And I'm happy to answer any questions about shockwave therapy or cases or anything.
One of the things I'm really curious about is when you treated your TPLO osteotomy site dog, how high energy did you have to go to initiate the bone healing?
Let me just pull up his case real quick and I'll tell you.
Because I'm finding, literature can say you need to go pretty high for bone.
Uh-huh.
But in reality, we're seeing different things. So I'm always curious.
I do not think that my intensity was that high. I'm used to doing the horses and I'll have them at like 20. And I've never had a small animal even remotely close to that. We had him at an intensity of 8.
Okay, so that's pretty high, but not
Yeah,
crazy, crazy.
not crazy.
But not painful at 8. So
No, not a problem. Never at any point showed reactivity to increasing his intensity.
interesting. Cool. And then this one's a little far out question for you, but
Okay.
lumbosacral disease has so many components of it, and shockwave affects so many different issues, whether it's the nerves, the inflammation, the blood flow. Any guess of what's causing that dramatic change, or a little
All of
bit of
the things.
everything?
I this is just a total guess. I have no
Yeah.
science to back this up. I feel like it's probably a big part like reduction in inflammation, just because I feel like a lot of times when I'm evaluating these LS dogs, they're so painful on palpation. You know,
Mhm.
I'm squeezing their LS and they're collapsing to the floor. And with treatments of this, they don't respond. They're starting to do their normal things. They're having their normal tail carriage. So to me, the analgesic effect must be a really big part of that because
Mhm.
I don't think that the effects, I mean, other than like reducing inflammation of nerves in the area, but we're not healing or changing the nerve pathways. So my guess is that it's really a lot based on the analgesic and like anti-inflammatory properties.
Yeah. I I go back and forth because there's some crazy interesting stuff about nerves and shockwave, but in that area, I don't think you're getting to enough of it to do a whole lot.
Yeah.
And uh, say a restricted nerve, say in the sciatic, there we've seen tremendous difference. But again, did we just loosen up the or reduce inflammation in the muscle that's restricted it? The other thing that came up in the conversation was oxygen to the nerves.
Hmm.
It's so important for them to fire well. Um, and obviously we get a lot of oxygen to the areas by treating with shockwave. So I'm always kind of have this
I would
fascination.
love to know.
I don't
I
know.
just
I
know it
know
works.
don't know that we'll ever be able to figure it out. It's just one of those geeky fascinations about um what really happens with the nerves in this situation, you know.
Yeah.
But LS is such a chronic or seen so much in
I'm
pet
seeing
dog,
it
but
all the
then
time now.
yeah, the working dogs
Yeah.
and are
Yeah, those
crazy.
shepherds and Malinois all the time. And I'm seeing it just really frequently undiagnosed, like coming in just for like a hind limb lameness or weakness. And I can't tell you the number of times that we've figured out that it's actually the LS and not hip dysplasia. I feel like I really get a lot of dogs that are like, they're here for their hip arthritis. And I'm like, this is a back problem.
In your supraspinatus case, you said
Mhm.
it took them multiple MRIs and then there was no biceps attached to the
The
supraspinatus?
weirdest case. Like originally the dog had his elbows and shoulders CT. They were looking for OCD lesions and other like elbow dysplasia. Didn't find anything there. I think one of the repeats is that they MRI'd the wrong shoulder. So it was just a total disaster of a case. It was tricky. And then ultimately the conclusion on the last MRI was that it was a supraspinatus tendinopathy with a little bit of like enthesophytes.
Wow. Because, in the paper that Dr. Tomlinson and Dr. Kern in the retrospective study, they rarely were seeing super without biceps.
Yeah.
Like
Uh,
that's not a normal
And maybe
injury.
the biceps got better because it took so long to find it. I don't know.
And the other had calcifications in it, so it didn't
Yeah,
perhaps. Yeah, we'll never know, but I
great
just was like
question. Yeah, it was a weird case. It was a very weird case.
crazy for sure. Well, always new things to learn and try. Definitely our seniors can't help but getting our seniors healing. And the fact that you're going up to 6 weeks and longer without having to treat in between with your seniors, that's good. I
It's
mean,
huge.
yeah, yeah, that's really
People
huge.
don't have the time, people don't have the finances to come in that often. And some of these dogs are nervous. A lot of dogs don't like being in the hospital. So when I have something that I can spread out as much as possible, I love it. And owners love it. When I tell them that it's going to last for a long time, they don't have to come once a week forever. They're very happy.
They're very happy, right? Yeah, for sure. And why, I mean, I guess partially because you are doing rehab and other things, so
Yeah. I'd say
yeah,
that's one of my favorite things about it too. I just feel like it pairs well with the other alternative modalities.
yeah, yeah, for sure. Um, I have an elbow dog that comes to my house and she's figured out 6 weeks is exact, like
There it
If she
is.
doesn't get
Like
here within
clockwork.
6 weeks, starts to limp. And I'm like, okay, it's
6
fine.
weeks it is.
6 weeks is what that dog wants, you
Yep.
know. Well, thank you, thank you. I really appreciate it. And super interesting to hear different things happening. And I hope that your puppy goes on for a really, really long time, because that's
Forever is the plan. I told her I would accept nothing else.
forever, because she can keep running and playing. No, that's
That's
amazing.
right. That's my
Um,
girl. She's here with me every day.
every single day is a new day. So,
That's right.
I thank you so much for your time. I thank you for showing us those interesting cases. And we'll see you down the road. And if anybody does have questions, you know how to find me, and I know how to find Dr. Katie. So thanks so much.